Bismillahirrahmanirrahim. Assalamu alaikum. This is Dr. Huri Amir. Today we are going to learn about the concept of dominant hemisphere. Now, what is dominant hemisphere and how it works and what are the role of different areas in this. Now, let's talk about them in detail. Now, the concept of dominant hemisphere, that is, the functions of vernix area and the angular gyrus, as well as the functions of speech and motor control areas, are usually much more highly developed in one cerebral hemisphere than in the other. So we have to learn that both the hemispheres, they are not having the same ability of being developing themselves, and one is more developed in comparison to the other, and that one which is more developed has been given the name of a dominant hemisphere. Now, the left posterior temporal lobe at birth is usually slightly larger in comparison to the right temporal lobe. The left side normally begins to be used to a greater extent than the right one. Now, because of the tendency to direct one's attention to the better developed region, the rate of learning in the cerebral hemisphere that gains the first start increases rapidly, whereas in the opposite, which one is the lesser in use, or we can say the less used side, the learning remains slight. The left side normally becomes dominant over the right. So that's why most of the time the people, they are right-handed type of people. They are doing their most of the work by the right hand, and vice versa. Now, the role of language in the function of vernix area and in intellectual functions. When we read a book, we do not store the visual images of the printed words, but instead we store the words themselves or their conveyed thoughts, often in language form. Now, the first introduction to language is by way of hearing it. Now, when the visual perception of language through the medium of reading develops, the visual information conveyed by the written words is then presumably channeled via angular gyrus, a visual association area, into the already developed vernix language interpretative area of the dominant temporal lobe. Now, when the vernix area in the dominant hemisphere of an adult person is destroyed, the person normally loses almost all intellectual functions associated with language or verbal symbolism, such as ability to read, ability to perform different mathematical operations, sums, and even the ability to think through the logical problems. Now let's talk about the functions of parieto-occipito-temporal cortex in the non-dominant hemisphere. Psychological studies in patients with damage to the non-dominant hemisphere have suggested that this hemisphere may be especially important for understanding and interpreting music, non-verbal visual experiences, spatial relations between the person and their surroundings. Higher intellectual functions of the prefrontal association areas. The prefrontal cortex is more important in higher intellectual functions than other portions of the brain and have not seen successful destruction of language comprehension area in the posterior superior temporal lobe, vernix area, and the adjacent angular gyrus region in the dominant hemisphere causes much more harm to intellectual functions. Now let's talk about what are the different effects which are being produced by the bilateral removal of prefrontal lobe. Now, what are the effects which are being produced by the removal or ablation of prefrontal lobe is this, that there is lack of self-control, there is distractibility, flight and irregular likeness, there is loss of memory, mainly that of recent events, there is change in the social behavior, there is loss of moral and social sense, orientation of time and space is disturbed, there is failure to realize the facts. Now, function of the brain in communication, language input and language output. There are two aspects to communication. First is the sensory input and the other one is the motor aspect. Now, the sensory aspect is that is this language input, which is via ears and eyes, and how the motor aspect is the language output, which is involving the vocalization and its control. Now, sensory aspects of communication. If there is destruction of portions of the auditory or visual association areas of the cortex, it can result in inability to understand the spoken word or written word. Now, these effects are called auditory receptive aphasia and visual receptive aphasia, or more commonly, there is word deafness or word blindness, which is known as dyslexia. You can see the different areas. Broca's area, excuse me, primary auditory area, Broca's area, Wernicke's area. They are all helping in speaking a heard word. And these areas which are like Broca's area, Wernicke's area, angular gyrus, they're all helping in speaking a written word. Wernicke's aphasia and global aphasia. Now, some people, they are capable of understanding either the spoken word or the written word, but are unable to interpret the thought which is expressed. Now, this results most frequently when Wernicke's area in the posterior superior temporal gyrus in the dominant hemisphere is damaged or destroyed. This type of aphasia is called Wernicke's aphasia. Now, what are the motor aspects of communication? The speech involves two principal stages of communication. That is the formation in the mind of thoughts to be expressed, as well as choice of words to be used, motor control of vocalization, and the actual act of vocalization itself. Now, what happens if there is loss of Broca's area, which is causing motor aphasia? Sometimes a person is capable of deciding what he or she wants to speak up or wants to say, but cannot make the vocal system emit the words which are suitable according to the thoughts and instead of the noises. Now, this effect is actually known as the motor aphasia, and it results from damage to Broca's speech area. Now, we should know about the pathway involved in hearing and speaking. Now, primary auditory area of the sound signals that encode the words. Then there is interpretation of words in Wernicke's area. Determination also in Wernicke's area of the thoughts and words to be spoken. then transmission of signals from Wernicke's area to Broca's area by way of arcuate fasciculus, then activation of skilled motor program in Broca's area for control of word formation, and last is the transmission of appropriate signals into the motor cortex to control the speech muscles. Now let's talk about the function of corpus callosum and anterior commissure to transfer thoughts, memories, training, and other information between the two cerebral hemispheres. Now, what we can say is that there is presence of fibers in the corpus callosum which provide abundant bidirectional neural connections between respective cortical areas of two cerebral hemispheres due to the presence of its increased number of fibers except for the interior portions of temporal lobes. These temporal areas, including especially the amygdala, are interconnected by fibers which pass through the interior commissure. Functions of corpus callosum and anterior commissure. These functions can best be explained by describing one of the experiments, which is a monkey is first prepared by cutting the corpus callosum and splitting the optic chiasm longitudinally so that signals from each eye can go only to cerebral hemispheres on the side of the eye. Then the monkey is taught to recognize different objects with its right eye while left eye is covered. Next, the right eye is covered and the monkey is tested to determine whether its left eye can recognize the same objects or not. The answer to this is that the left eye cannot recognize the objects. On repeating the same experiment in another monkey with the optic chiasm split but the corpus callosum intact, it is found invariably that recognition in one hemisphere of the brain creates recognition in the opposite hemisphere. Functions of the corpus callosum and the anterior commissure is to make information stored in the cortex of one hemisphere available to corresponding cortical areas of the opposite hemisphere. Important examples of such cooperation between the two hemispheres are following. Cutting the corpus callosum blocks transfer of information from Wernicke's area of the dominant hemisphere to the motor cortex on the opposite side of the brain. The intellectual functions of Wernicke's area located in the left hemisphere, they lose control over the right motor cortex, which initiates voluntary motor functions of the left hand and arm, even though the usual subconscious movements of the left hand and arm are normal. Cutting the corpus callosum prevents transfer of somatic and visual information from the right hemisphere into the Wernicke's area in the left dominant hemisphere. Somatic and visual information from the left side of the body frequently fails to reach this general interpretative area of the brain, and therefore